Hello, I will be talking about the healthcare in the US and comparing it to other countries. So, starting off, we will be looking at the beverage model, which is designed to provide universal healthcare to citizens, which is funded by the government and the taxpayers. Countries like Canada, UK, and New Zealand have this model, and it have been effective because it promotes equity and citizens are most likely to seek for medical help. And looking at the Bismarck Health model, it is funded by employers that consist of private health insurance and companies. Countries like Germany and France use this model, and it is effective because citizens are required to have healthcare insurance, which ensures that they have access to medical help. And since it is a private health insurance and company, it allows the citizen to receive good medical help. And looking at the National Healthcare Insurance, the NHI is funded by the government, which runs the healthcare programs and it allows the citizen to pay for lower like medical costs. For example, countries like Taiwan and Japan have this model. And the wait time for these countries are very short and they're able to get patients in and out fast at a low cost. Okay, now looking at the US healthcare, we have a mixed model of public and health insurance. The majority of US healthcare involves private healthcare where it is purchased through employers or through the healthcare market. Even though we do have low income medical insurance like Medicaid, Medicare, the poverty level and expectation and requirement to be eligible for this program is very low. For example, Texan with individual has to make only about 1,500 a month to meet the requirement, which is extremely low because 1,500 is now like the minimum payment for rent. Okay, and then if we look at the risk, we can see that medical like is putting a lot of our people in danger because insurance company incur higher like administrative costs and they pass on those costs to consumers by making them pay higher premiums. And then the co-pays in the US are much higher because, for example, right, when people in the UK visit the doctor, it costs about $80 for them to go in and out, while the minimum cost in the US would be around $190 to $200. Okay, and then 41% of our adults are in medical debt, which shows how it's about to reach half of our population. And then two-thirds of reported medical debt, which is which have shown that it is associated with homelessness. So when we look at the models in other countries, it have proven that it has been effective. Caused, it has allowed like lower mortality rate. It have reduced debt for their citizens and stuff. So looking at other models, it has proven that the US can also provide universal or NHI or Bismarck model for people.